What if the position you trust every single night is the very position that leaves you waking up tired, foggy, stiff, short of breath, or with numbness in your hands? For many adults over 60, the first thought in the morning is, I'm just getting older. But sometimes the problem is not age itself. Sometimes it is what your body has been forced to tolerate for 7 or 8 hours while you were asleep. Tonight, before you close your eyes, I want you to pay attention to something most people never think about: where your neck is, how your chest is expanding, whether your airway is open, whether your stomach acid can move upward, and whether your legs and spine are supported. Your sleep position is not a magic cure. It will not replace your medication, your doctor, or a proper evaluation, but it can quietly influence breathing, reflux, neck pressure, circulation, and the quality of sleep your heart and brain depend on. I'm Dr. Caleb Rowan, and in this video I'm going to walk you through 5 common sleeping positions, from the ones that tend to create the most problems for older adults to the ones that may support easier breathing, better comfort, and safer alignment. Before we go deeper, comment your age and the position you usually fall asleep in: left side, right side, back, or stomach. Then stay with me until the end, because the most important part is not simply knowing which position sounds best. It is learning how to change your position safely without waking up with shoulder pain, neck pain, or a lower back that feels worse than before. When you fall asleep, your body changes gears. Your heart rate slows, your breathing pattern changes, your blood pressure often dips, your muscles relax, your brain begins cycling through repair, memory processing, and deep restorative sleep. Under normal circumstances, this is exactly what you want. Sleep is one of the most powerful recovery systems the body has. But after 60, the body is usually working with a different set of conditions than it had at 30 or 40. Arteries may be stiffer, blood pressure may be more reactive, the muscles that help keep the airway open may not hold the same tone through the night. Many people have some degree of snoring or obstructive sleep apnea and do not know it. Reflux becomes more common. Neck arthritis, spinal stenosis, shoulder problems, hip pain, and venous circulation issues in the legs become more common as well. That means a position that felt harmless for decades may no longer be harmless for your current body. Comfort is not always the same thing as safety. Comfort often means familiarity. Your body learns a habit and returns to it automatically, even if that habit is adding stress somewhere else. I want to be very clear about the science here. A sleep position by itself does not directly cause a stroke in most people. That would be too simplistic, and it would be irresponsible to say. Stroke risk is affected by blood pressure, diabetes, atrial fibrillation, smoking, cholesterol, sleep apnea, medications, blood vessel disease, family history, and many other factors. But a poor sleep position can make certain risk factors worse. It can worsen oxygen dips in people with sleep apnea. It can aggravate reflux and nighttime coughing. It can place the neck in a strained position for hours. It can disturb sleep again and again until the body never reaches the depth of recovery it needs. And that is why this matters. You are not just choosing a comfortable shape in bed. You are choosing the mechanical environment your body will live in for 1/3 of your life. The position I want older adults to be most cautious about is stomach sleeping. Not because every person who sleeps on the stomach is in immediate danger, but because this position tends to combine several mechanical problems at once. When you sleep face down, you cannot breathe through the mattress, so your head must rotate to one side. That rotation may last for hours. If your neck is young, flexible, and pain-free, you may tolerate it. But if you are over 60 and you already have arthritis, disc degeneration, narrowing in the spine, dizziness, headaches, or nerve symptoms, that rotation can be a problem. Think about what is happening. Your neck is not neutral. One side is shortened, the other side is stretched. The small joints in the cervical spine are compressed unevenly. The muscles around the base of the skull stay active when they should be resting. Then you wake up and wonder why the morning begins with stiffness, a heavy head, or a strange sense that it takes an hour to feel clear. Now add the chest. In stomach sleeping, the front of the body is pressed into the mattress. The rib cage cannot expand as freely. The diaphragm may not move as comfortably. In someone with snoring, sleep apnea, chronic congestion, COPD, obesity, or reduced lung reserve, that can make nighttime breathing less efficient. Again, this is not about panic. It is about pressure. If the body is already working harder to breathe at night, why put it in a position that makes expansion more difficult? The lower back can suffer too. Many stomach sleepers end up with the lumbar spine slightly extended, almost like a mild backbend held for hours. If you have spinal stenosis, facet joint arthritis, or sciatica, this can make morning back pain or leg symptoms worse. Some people also tuck an arm under the pillow or under the chest, and that is when they wake up with tingling, numb fingers, or a shoulder that feels locked. I once worked with a man in his mid-70s who told me he woke up every morning feeling old before the day even started, his words. His neck was stiff, his hands were sometimes numb, and his head felt heavy for the first hour. He had been sleeping on his stomach since he was a teenager. Nobody had ever asked him about it. When we changed only one thing at first, moving him away from the stomach position into a supported side position, he did not become a new person overnight. But within a couple of weeks, the pattern changed. Less neck tension, less hand numbness, less morning dread. That is not a miracle. That is mechanics. If you are a stomach sleeper, do not shame yourself, do not panic, and do not try to force yourself into the perfect new position tonight. That almost never works. Your first goal is simply to stop rotating the neck so aggressively for so long. A good first step is to transition toward side, sleeping with a pillow in front of your chest and another between your knees. That gives your body something to rest against so you do not roll face down as easily. The next position is one many people assume is automatically the healthiest, lying flat on the back. In some ways, back sleeping can be excellent. The spine can stay more neutral. The face is not pressed into the pillow. The shoulders are not bearing the full weight of the body. For some people, especially those without snoring, reflux, or breathing problems, it may be perfectly comfortable. But the problem is not back sleeping itself. The problem is lying completely flat when your airway, stomach, or circulation does not tolerate it well. When you lie flat on your back, gravity pulls the tongue and soft tissues of the throat backward. In a person with obstructive sleep apnea or positional snoring, that can narrow the airway. The result may be louder, snoring, brief pauses in breathing, oxygen dips, restless sleep, and a surge of stress signals that wakes the body over and over even if the mind does not fully remember it. This is one reason some people sleep for 8 hours and still wake up exhausted. If your spouse says you snore loudly, gasp, choke, stop breathing, or jerk awake, do not dismiss that as normal aging. That is a reason to speak with a clinician about sleep apnea testing. Untreated sleep apnea is associated with high blood pressure, atrial fibrillation, heart disease, stroke risk, insulin resistance, and daytime fatigue. A pillow alone is not a full treatment for sleep apnea. Many people need proper diagnosis and CPAP or another medical therapy, but position can still matter, especially for those whose breathing is worse when they lie flat on their back. Flat back sleeping can also aggravate reflux. If you eat late, lie flat, and the valve between the stomach and esophagus is not working perfectly, acid can move upward more easily. That may show up as heartburn, sour taste, chronic throat clearing, hoarseness, nighttime coughing, or a feeling of chest pressure that causes fear and poor sleep. Many older adults do not connect their morning throat irritation or coughing with what happened while they were lying flat. Then there are the legs. Lying flat is not usually the main cause of blood clots, and I do not want to exaggerate that. The bigger risk factors include surgery, immobility, cancer, smoking, estrogen therapy, clotting disorders, long travel, prior clots, and certain medical conditions. But if a person has venous insufficiency, swelling, restless legs, or poor mobility, the way the legs are supported at night can affect comfort, fluid movement, and sleep quality. If your legs feel heavy, swollen, or achy at the end of the day, your sleeping setup deserves attention. So if you sleep flat on your back and you wake up refreshed, breathe well, do not snore, do not reflux, and feel good, you may not need to change much. But if you wake up with dry mouth, morning headaches, fogginess, reflux, breathlessness, or nighttime coughing, flat back sleeping is not as neutral as it looks. The third position is right side sleeping, and this is where we need to be balanced. Some videos online make it sound as if the right side is dangerous for everyone. That is not true. Many people sleep beautifully on their right side. It can reduce pressure on the lower back, keep the spine more aligned than stomach sleeping, and help people who cannot tolerate lying flat. For some heart failure patients, the right side may even feel more comfortable than the left side. So I do not want you to hear fear. I want you to hear individualization. The main issue with right side sleeping is reflux. Because of the shape and position of the stomach, lying on the right side can allow acid to linger near the junction between the stomach and esophagus in a way that may worsen nighttime reflux for some people. If you sleep on your right side and you often wake with burning, sour taste, coughing, throat clearing, or pressure after late meals, this is worth testing carefully. Not by forcing a dramatic change, but by trying a left side position or upper body elevation for a couple of weeks and observing whether symptoms improve. There is also the heart question. The heart sits slightly left of center, and body position can change how the heartbeat is perceived. Some people feel palpitations more strongly on the left side. Some people with heart failure naturally avoid the left side because it feels uncomfortable or makes breathing harder. Others feel better on the left. This is exactly why blanket rules can be misleading. If you have known heart failure, significant arrhythmias, an implanted defibrillator, chest pain, severe shortness of breath, or worsening symptoms in a certain position, do not force a position because a video told you to. Use your symptoms as information and discuss them with your doctor. If you are a right side sleeper, comment right side below. I want to know how many people in this community naturally choose that position. And as you listen, do not ask, is my position good or bad? Ask a better question. Does my position support my breathing, my reflux, my spine, my shoulders, and my morning energy? Now we come to one of the most useful modifications for adults over 60, the elevated back position. This is not simply stacking a mountain of pillows under your head until your neck bends forward. That can create a new problem. The goal is to elevate the upper body as one unit, from the upper back through the head, so the airway is less likely to collapse and the stomach contents have a harder time flowing upward. For many people with snoring, reflux, congestion, or difficulty lying flat, this is the first position I want them to consider. You can use a wedge pillow, an adjustable bed, or a carefully arranged incline that supports the torso. A wedge is often better than loose pillows because it keeps the angle consistent. When you use only pillows under the head, the chin may drop toward the chest. That can narrow the airway and strain the neck. When the torso is elevated, the throat, chest, and stomach are supported more naturally. How high is enough? Many people start around a gentle incline, roughly 20 to 30 degrees, and adjust based on comfort. Some need less, some need more. The right amount is the amount that helps breathing or reflux without causing neck strain, hip pressure, or sliding down the bed. If you have severe sleep apnea, this is not a substitute for treatment. But for selected people, elevation may reduce positional airway collapse and improve comfort. This position can also be helpful for people who simply cannot sleep on the left side because of shoulder pain, hip pain, surgical history, or heart symptoms. There is no prize for forcing a position your body rejects. The goal is not perfection. The goal is a safer, more supportive sleep environment. Here is a practical way to test it. Try the elevated position for 7 nights. Do not change 5 other things at the same time, or you will not know what helped. Keep dinner timing similar. Keep caffeine similar. Then track 4 things in the morning: dry mouth, headache, reflux or throat clearing, and energy. Ask your spouse or partner whether snoring changed. If you use a smartwatch or oxygen monitor, you may also look at trends, but do not obsess over one night. Sleep data is noisy. Patterns matter more than a single reading. I have seen this help people who were convinced they had just gotten old because every morning felt heavy. Sometimes the issue was not age alone. It was lying flat with reflux, snoring, nasal congestion, or an airway that struggled all night. When the body stops fighting for air, sleep can finally become sleep again. And then we come to the position many adults should understand better: left side sleeping with proper support. Notice the phrase, with proper support. Left side sleeping is not helpful if your neck is bent, your shoulder is crushed, your lower back is twisted, and your top leg is pulling your spine forward. The position only becomes useful when the body is aligned. The left side has several potential advantages. For people with nighttime reflux, left side sleeping has been studied and appears to reduce acid exposure for many patients. The anatomy of the stomach makes this position more favorable for keeping acid lower and away from the esophagus. If reflux wakes you up, this alone may be reason to test the left side. Left side sleeping may also help some snorers because side sleeping generally reduces the tendency of the tongue and soft palate to fall backward compared with lying flat on the back. Again, if you have true sleep apnea, you need proper care. But for positional snoring or mild positional airway issues, side sleeping can be meaningful. For the spine, the left side can be excellent when supported correctly. The knees should not collapse together unevenly. The top hip should not roll forward. The neck should not tilt up toward the ceiling or drop down toward the mattress. Your ear should be roughly in line with your shoulder. Your nose should point straight ahead, not down into the pillow or up toward the wall. The simplest setup is a pillow between the knees. This reduces twisting through the hips and lower back. If you have wider hips, you may need a thicker pillow. If your hips are narrow, a thinner pillow may be enough. The goal is for the top leg to rest parallel, not drag your spine into rotation. Then place a pillow in front of your chest or use a body pillow. Let your top arm rest on it. This prevents the top shoulder from collapsing forward and helps keep you from rolling onto your stomach. The bottom arm is important. Do not tuck it under your head. That is one of the most common mistakes. When the bottom arm is trapped under the head or body, circulation and nerve pressure can cause numbness, tingling, shoulder irritation, or elbow pain. Instead, bring the bottom arm slightly forward or rest it comfortably along the mattress. If the shoulder underneath you hurts, try slightly rolling your torso backward with a pillow behind you, or place a small, soft support near the chest so the shoulder does not take all the pressure. Now, who should be careful with left side sleeping? Anyone with heart failure who feels worse on the left side, anyone who develops shortness of breath, chest pressure, palpitations, or discomfort in that position, anyone with severe left shoulder, arthritis, or recent surgery, anyone recovering from procedures where a doctor gave specific sleep instructions, and anyone who simply cannot sleep that way despite good support. Health advice must fit the person, not the other way around. This is why I prefer a 30-day experiment, not a command. Your body gives feedback. If left side sleeping reduces reflux, snoring, morning fog, or neck tension, that is valuable. If it causes shoulder pain or breathlessness, adjust. Maybe elevated back sleeping is better for you. Maybe alternating sides with support is better. Maybe the real issue is sleep apnea and you need testing. The point is not to worship one position. The point is to stop sleeping in a way that quietly makes your known problems worse. So here is the practical plan I want you to start tonight. On the first night, do not try to fix everything. Just observe. Before you fall asleep, notice your default position. Where does your body want to go? Are you face down, flat on your back, curled tightly on the right side, halfway twisted with one leg thrown forward? Then when you wake up, notice where you ended up. Many people fall asleep in one position and spend most of the night in another. You cannot change what you do not first observe. If you are a stomach sleeper, use nights 2 through 5 to move away from the stomach gradually. Do not demand that your body suddenly love left side sleeping. Start by building a barrier. Put a pillow in front of your torso so your chest has something to rest against. Put another pillow between your knees. If needed, place a pillow behind your back so you do not roll flat or face down. Your goal is to become comfortable in a side position without neck rotation. From nights 6 through 14, start building the more supported position. If left side sleeping feels good, use it. If right side sleeping is the only side you tolerate at first, use that as a transition, especially if it gets you off your stomach. The first victory is reducing strain. The second victory is optimizing. Add the knee pillow. Add the body pillow. Adjust the head pillow so the neck stays neutral. If your pillow is too high, your neck bends upward. If it is too low, your head drops. Both can create stiffness. If you are a back sleeper with snoring, reflux, or morning headaches, test elevation. Use a wedge pillow or elevate the upper body in a stable way. Do not just pile pillows under your head. Keep the torso supported. Try it for at least a week, unless it causes discomfort. Track your symptoms, not your imagination. Are you waking less? Is reflux better? Is your throat less irritated? Is your partner reporting less snoring? Are you less foggy in the morning? There are a few mistakes I want you to avoid. The first is forcing the transition too quickly. If you have slept one way for 40 years, your nervous system and joints may resist sudden change. That does not mean the change is wrong. It means the change needs to be gradual. The second mistake is using the wrong pillow. A pillow is not just a soft object under your head. It is a spinal alignment tool. Too high can bend the neck. Too flat can collapse the neck. Too soft can let the head sink and twist. A good pillow keeps the head, neck, and upper spine in a relaxed line. The third mistake is ignoring shoulder pain. Pain is not proof that you failed. Pain is information. If the shoulder hurts on the left side, adjust the angle. Use a body pillow. Try a small pillow behind the back so you are not fully loaded onto the shoulder. Try the elevated back position instead. Do not push through sharp pain. The fourth mistake is thinking that familiar means healthy. This may be the most important one. Many people say, "But doctor, I've slept this way my whole life." I understand, but your body at 70 is not the same body you had at 30. Your joints, airway, blood vessels, muscles, and recovery capacity have changed. A position that used to be harmless may now be contributing to symptoms you thought were unavoidable. As you make these changes, remember the red flags. If you wake up with one-sided weakness, facial drooping, trouble speaking, sudden confusion, sudden vision changes, severe dizziness, or the worst headache of your life, do not troubleshoot your pillow. Call emergency services. If you wake repeatedly gasping, choking, or your partner notices pauses in breathing, talk to your doctor about sleep apnea. If you have chest pain, severe shortness of breath, or new irregular heartbeat symptoms, get medical care. Sleep position can support health, but it is not a substitute for diagnosis. For everyone else, this is your 30-day challenge. For 30 days, study your sleep position the way you would study your blood pressure, your blood sugar, or your steps, not with fear, with curiosity. Notice what happens when the neck is neutral. Notice what happens when the chest can expand. Notice what happens when reflux is reduced. Notice what happens when the spine is not twisted all night. Small changes repeated every night can create a meaningful difference in how you feel every morning. Let's bring this home. Stomach sleeping is often the least helpful position for older adults with neck pain, breathing problems, reflux, numbness, or back stiffness, because it tends to twist the neck and compress the front of the body. Flat back sleeping can be fine for some people, but if you snore, gasp, reflux, or wake up foggy, lying completely flat may be working against you. Right side sleeping is not bad for everyone, but if reflux is your problem, it may be worth testing another position. Elevated back sleeping can be a powerful option for people who need better airway support or reflux control and cannot tolerate side sleeping. Left side, sleeping with a pillow between the knees and proper neck support may be one of the best options for many people, especially those dealing with nighttime reflux or back strain, but it must be individualized. Tonight, do not just go to bed. Study your position. Take 10 seconds before you fall asleep and ask, is my neck neutral? Can my chest expand? Are my knees supported? Am I forcing my shoulder? Am I lying flat even though I know I snore or reflux? That one moment of awareness may change the way you sleep for the next decade. And if you are over 60, please do not hear this as another thing to fear. Hear it as something you can control. You cannot control every risk factor. You cannot rewrite your genetics. You cannot undo every year of stress or every diagnosis. But you can change the environment your body sleeps in tonight. You can give your airway a better chance. You can give your neck a better position. You can give your stomach a better angle. You can give your spine and hips better support. Comment below with the position you are sleeping in tonight. Left side, right side, back, or stomach. Then tell me the first change you are willing to test for the next 7 nights. If someone you love is over 60 and wakes up tired, foggy, breathless, stiff, or with numb hands, share this with them. Not because one video can diagnose them, but because one simple observation can start the conversation they may need with their doctor. And if you want more clear, practical health guidance for staying strong, independent, and sharp as you age, subscribe to the channel. In the next video, I'll show you the nighttime warning signs many people ignore until their sleep, heart, and energy are already suffering. Until then, take care of your body tonight. It is working for you while you sleep. Give it the position, support, and attention it deserves.